Hello and welcome, everyone. Thank you for joining us today for our webinar. This is part 2 of a 4-part webinar series that we are offering. Today's webinar is going to cover an overview of the OMH and OASIS Behavioral Health Services. We are going to have a whole constellation of different presenters today who will introduce themselves as we go through the slides. I'm going to start. My name is Meg Beyer. If you have listened to the first webinar, you heard my voice and my colleague's voice. I work at the McSilver Institute for Poverty Policy and Research, and I'm excited today to be delivering some of this webinar in my role as a MCTAC Technical Assistance Training Partner. So with that, I just wanted to go through some of our partners who have really worked in a collaborative fashion to develop this webinar series. As you can see, we have the Center for Practice Innovations, NYAPRS, the McSilver Institute, CASA, and the Office of Alcoholism and Substance Abuse Services, as well as the Office of Mental Health. So with that, I'm going to pass along to my colleague who will introduce himself and help frame the overarching principles for this webinar series.
Thank you, Meg. And my name is Boris Vilgorin. I'm also with McSilver Institute and MCTAC. And today, as Meg mentioned, again, we're going to have presenters provide an overview of OMH and OASIS, services throughout the state that are available. But just to kind of take a step back for a moment, and just to kind of, discuss a little bit why we're doing this and what's the purpose of this entire series. So the purpose here is really to educate and inform the entire behavioral health staff, including the health home care managers, the health home leads, and the health plans that have been participating in this transition of behavioral health services and implementation of HCBS in the last year or so. And the idea here was for the technical assistant partners to come together to develop really a robust, integrated presentation that really provides information for all. Again, as we all work with individuals who need our support, we want to make sure that they're making the best choices in the way that will help them with their recovery and to better their life. And with that, we also understand that, as you play that role in providing information, we want to make sure you have the most up-to-date information on the services and are able then to convey that information to the individuals. So when you're talking to them about programs and services throughout the state, it could be part of that, person-centered and informed decision-making process with that. And again, so we're very excited and very happy to have all of the technical assistants and training partners throughout the state to join us together with OMH and OASIS. This was developed. And so with that, I'm going to pass the presentation to our next presenter, and who would start you through the OMH services here. So with that, Paul and Sapana, the ball is in your court.
Thank you, Boris. My name is Sapana Patel from the Center for Practice Innovations, and I'll be starting us off today by talking a little bit about the OMH and OASIS Behavioral Health Services, particularly starting with the Office of Mental Health, Adult Mental Health State Plan Services. These include inpatient psychiatric services, mental health clinics, partial hospitalization programs, personalized recovery-oriented services or PROS programs, assertive community treatment or ACT, continuing day treatment programs, CDT, comprehensive psychiatric emergency programs, CPEPs, intensive psychiatric rehabilitation treatment, and rehabilitation services for residents of community residences. I'll start by describing inpatient psychiatric services. These services provide stabilization and intensive treatment and rehabilitation within 24 hours in a controlled environment. They are a program of choice when required services and supports cannot be delivered safely in community settings. The focus of inpatient psychiatric services are treatment. Services can be delivered individually or in groups, and services are site-based only and may be provided in an inpatient psychiatric unit of a general hospital, at a private psychiatric hospital, or at a state psychiatric center. These settings are licensed by OMH, and they are funded under the federal clinic option. Referrals are made typically directly to the provider, and no pre-authorization for managed care is required. Next is a mental health clinic. These are Article 31 mental health clinics that offer services designed to reduce symptoms, maximize potential recovery, improve social and familial functioning, and increase hopefulness and goal setting. Licensed clinical social workers and psychiatrists provide holistic care within these settings, and services may include individual therapy, group therapy, medication management, as well as education. The intensities of these services and number and duration of visits may vary. Most widely used are these mental health clinic services. The focus of the mental health clinic is treatment. The modalities can be delivered individually or in groups, and the menu of services are available and based on intensity and need of the individual. Services are site-based only. The space is licensed typically. For managed care, some services can now be provided in the community. This is funded under the federal clinic option, and again, referrals made directly to the provider, and no pre-authorization is needed for managed care. I'll now pass the presenter role on to my colleague, Paul Margulies. Paul?
Thank you so much, Sapana. Hi, everybody. This is Paul Margulies from the Center for Practice Innovations, and we're going to begin by talking about partial hospitalization. And as you may be aware, a partial hospitalization program provides active treatment designed to stabilize and ameliorate acute symptoms. It serves as an alternative to inpatient hospitalization or to reduce the length of a hospital stay within a medically supervised program. It focuses on treatment. The services can be delivered individually or in groups. So there's a menu of services that are available, and what's provided is based on the intensity and need. The services are site-based only, and the space itself is licensed, and it's funded under the federal clinic option. Now we're going to move on to personalized recovery-oriented services, also known as PROS programs. And PROS is a recovery-oriented model of providing integrated rehabilitation, treatment, and support services to adults who have been diagnosed with serious mental illness. And it's done in order to help them attain and sustain chosen life roles. PROS offers 4 components: community rehabilitation and support, which is known as CRS, intensive rehabilitation, IR, ongoing rehabilitation and support, ORS, and also clinical treatment. These components are comprised of services designed to assist the participant to overcome mental health barriers in an effort to achieve his or her chosen life role. And a number of these services are evidence-based. PROS services can be delivered individually or in a group and can be offered at the program site or in the community. But it's important to point out that PROS is not a day program. And more typically, it's compared to a college setting where people participate in services related to their goals. The focus is on rehabilitation and treatment. Services can be delivered, as I'd mentioned before, individually or in groups. It's a comprehensive model which is inclusive of multiple services delivered by a multidisciplinary team. And the services include employment supports. It's predominantly site-based, but any service can be delivered in the community. It's funded under the federal rehab option, and referral can be made by a provider. A person can walk in, and there's no pre-authorization screening for screening in managed care. Next, we come to Assertive Community Treatment, also known as ACT. ACT is an evidence-based practice model designed to provide treatment, rehabilitation, and support services to individuals who are diagnosed with a severe mental illness and whose needs have not been well met by more traditional mental health services, and that's very important to point out. ACT teams are multidisciplinary, and team members work collaboratively to deliver integrated and tailored services to assist recipients in making progress towards goals. The staff to recipient ratio is small. It's 1 clinician for every 10 recipients. And services are provided 24 hours a day, 7 days a week, for as long as they are needed. The focus, as I had mentioned, is on treatment and rehabilitation and also care management. The services can be delivered individually. It's a comprehensive model and is inclusive of multiple services delivered by a multidisciplinary team. It's important to point out that this is not site-based. Services must be delivered in the community. It's funded under the Federal Rehab Option, and access to ACT programs is through SPOA's Single Point of Access. Let's talk about continuing day treatment programs, otherwise known as CDTs. A CDT is a program which provides seriously mentally ill adults with skills and supports necessary to remain in the community and to work towards a more independent level of functioning. Participants often attend several days per week with visits lasting more than an hour. The focus is on treatment. The treatment services are provided at the program. The services can be delivered individually or in groups. And as I mentioned, the model is site-based. I'm now going to turn things over to my colleague, Ruth Cologne-Wagner from NYS. And Ruth, take it away.
All right, wonderful. Thank you so much, Paul. I really appreciate it. The next program that we're going to be reviewing is the Comprehensive Psychiatric Emergency Room, and it's also known as CPEP. CPEP is a licensed hospital-based psychiatric emergency program, and it establishes primary entry point to the mental health system for people who may be mentally ill, too ill to receive emergency, and they will be receiving emergency observation, evaluation, care, and treatment in a safe and comfortable environment. Now, CPEP is treatment, and that is provided inpatient. Due to the emergency or acute nature of it, treatment is inpatient. Services are delivered individually and are available 24 hours, 7 days a week. The model is site-based, and the site is licensed by OMH. What makes CPEP special is that it combines 4 components, and that's crisis intervention, extended observation beds, crisis outreach, and crisis beds. Okay, next let's review Intensive Psychiatric Rehabilitation Treatment, or IPRT. IPRT is a time-limited rehabilitation program for adults which focuses on building skills and developing community supports to assist individuals to attain specific residential, learning, working, or social goals. And it's designed to increase the functioning of persons with psychiatric disabilities so that they can be successful and satisfied in their environments of choice with the least amount of professional intervention. IPRT is focused on rehabilitation. The services can be delivered individually or in groups. The model is predominantly site-based, but some services can be delivered in the community, and it's funded under the Federal Rehab Option. Although IPRT is time-limited, it is very intensive and comprehensive. You'll see here at the end there are 3 IPRTs in New York State, and this service is therefore not available in all regions. But it's important to know that some IPRTs, many of them converted to PROS programs, and they have rehabilitation if you're looking for that. Next, I'd actually like to talk about community support programs. And community support programs are designed to provide an experience of mutual support, networking, and advocacy, and it's important to know that this is not mental health treatment. So the first is drop-in centers, and they engage people who may not otherwise choose to participate in a more structured service or in mental health treatment. The services are provided in a manner that individuals would accept. They're open and low demand, they're flexible, and they're unstructured. They're also responsible to meet individual needs and work around their circumstances. The next is psychosocial clubs, and they promote recovery through self-help, community living, academic and vocational exploration, and socialization. And they work to reintegrate people and find meaningful life roles in the community. The next is recovery centers, and that's a peer support program to help people work and fully participate in communities. And it can serve as a clearinghouse for community opportunities. Our activities are based here on the principle that people who share a common condition or a common experience can be of substantial assistance to each other. And this is the same for the following program, Self-Help. It's a peer support program providing rehabilitative support activities through support groups and networks. Next, let's talk about vocational services. And they're designed to engage people in seeking and maintaining employment in order to maximize their independence and their success. So first, let's talk about supportive employment. These services are intensive and they're ongoing, and that allows people to work in a setting that otherwise they would not be able to work in competitive employment without this support. The next is assisted competitive employment, or ACE, and this assists with obtaining and maintaining employment, and services are intensive and they're ongoing. Next is Transitional Employment Program, and it's designed to strengthen the person's work record and their work skills, and which includes soft skills, toward finding success in employment that is either assisted or competitive employment. The next is Affirmative Business Industry, and that is really an alternative to sheltered workshops, and it's intended to provide job training and employment opportunities in small retail businesses. And the following, the last one here, is Enclave in Industry, and it is initial and ongoing training activities on the job, service and training opportunities that are provided directly in the work setting for approximately 3 to 8 people. And then we have residential services. OMH also licenses housing options for people with psychiatric disabilities. And the first here, let's talk about community residences. Transitional housing program with 24-hour staff support, and they provide skills training for successful reintegration into the community. The next is treatment apartments, and they provide adults with an apartment in the community. There is a high level of staff support, and they visit as necessary, and they provide rehabilitation services designed to improve the person's functioning and develop even greater independence. The last one here is supported housing, and that also provides adults with an apartment in the community, and staff provide supportive services to address certain behavioral or environmental issues that may impact their ability to remain in the community and independent. Next, I am going to pass the presentation to my colleague, Carla.
Thanks, Ruth. I appreciate that. So my name is Carla Licio, and I am from the National Center on Addiction and Substance Use, and I am part of the Managed Care Technical Assistance Center. I'm going to walk you through an array of services within the OASIS system, starting with crisis services and walking you all the way through to prevention. Our hope today is that you'll be able to use these slides as reference points going forward, because we recognize there's a lot of information that we're presenting today. It's a lot to hold on to. So I encourage you to use the slides as references in the future. What I'd like to start with on the OASIS side is the locator. The locator is a placement tool that was designed in collaboration between CASA and OASIS. This tool is important for all of you to know about because as I go through the OASIS services, you may wonder, how do I know which service is appropriate for my particular individual that I'm working with? And the locator is there so that you don't have to make that decision on your own and alone. The locator is the level of care for alcohol and drug treatment referral. It is based on placement criteria that is based on the admission criteria and are used within a clinical process. OASIS providers, not non-OASIS providers, but OASIS providers will administer the locator before admission to a service. So you, as a non-OASIS provider, can make the referral to an OASIS provider, and at that point, the OASIS provider will walk the client through the locator, which will then direct that provider to determine if the level of care that you have referred them to is appropriate for this client or not. If the locator indicates a different level of care is needed, then the referral will be made at that point. So I want to start with crisis services. Within the OASIS system, crisis services really speak to the management of withdrawal. And so this first slide walks you through the different levels of withdrawal because those tie to the different services. So the most intensive services are there to address individuals who are experiencing or are at risk of experiencing severe withdrawal. These are withdrawal symptoms that may be life-threatening. It may be that this individual has physical health conditions that may be exacerbated by withdrawal or make withdrawal more serious. Or it may be that the individual has mental health conditions that make stabilization more complicated. The next level of withdrawal, stepping down, is moderate withdrawal. These are symptoms of withdrawal that cause significant discomfort or distress, the need for medication with a slow taper and observation to ensure that the individual is not worsening to severe withdrawal is required. And finally, there is mild to minimal withdrawal. Included in this category is a concept called persistent withdrawal symptoms, and those can be symptoms that are mild to moderate, but are long-lasting and protracted and may interfere with a person's ability to engage in treatment. Oftentimes, you'll see someone in mild to minimal withdrawal when they are admitted from another level of care, but they're not in need of acute detox services. But in order for them to adequately engage in treatment, they need relief from withdrawal symptoms. And so OASIS has a spectrum of withdrawal services to address these varying needs. On the left, we're talking about crisis services. And medically managed and medically supervised are both inpatient services, and they are varying degrees of medical intervention, from the most intensive medical intervention to a step down from that, but really requiring ongoing medical monitoring. Medically supervised outpatient withdrawal and stabilization is intensive but can occur on an outpatient basis. And finally, in today's system, there is a service identified as medically monitored withdrawal and stabilization. I'm not going to go into that too far because OASIS is in the process of phasing that service out. Another place where withdrawal can be managed is an inpatient rehab. I go into that later on in the webinar. Withdrawal management services are provided there. OASIS's newly redesigned residential services include an important element identified as stabilization. Within that element, ancillary withdrawal services are required to be available. And finally, ancillary withdrawal management services can also be available in the outpatient services. And if you wait a second, I'm going to talk a little bit more about ancillary withdrawal. Ancillary withdrawal services are designed to stabilize a patient who is experiencing mild to moderate or protracted withdrawal. It is the medical management of these symptoms within an OASIS certified setting. Medical staff will monitor withdrawal symptoms. It is a service that seeks to stabilize the patient through safe and effective management of mild to moderate and protracted symptoms, with the goal being that if these symptoms are addressed up front within a treatment setting, then that individual can engage in treatment immediately and improve their treatment experience and improve the possibility that they will stay in treatment and thus improve their outcomes. Staffing for these services include physicians, registered nurses, and clinical staff. I'm going to go next briefly to inpatient services, and I should specify this is inpatient, not crisis. This is inpatient rehabilitation. It is a 24-hour supervised, structured, short-term intensive treatment service. It's delivered in a hospital or freestanding facility. Medical and individualized treatment services are provided to individuals who have co-occurring medical or psychiatric conditions or are using substances in a way that puts them in danger. So this is inpatient rehab is an opportunity for someone to enter treatment who may not be able to enter treatment through the outpatient system safely. Which brings us right to outpatient services. The first outpatient service I'm going to discuss is brief intervention. And this is actually for individuals who, through a screening process, are determined to not meet the diagnostic criteria for admission to SUD services, but do meet at least one criteria for an SUD-based diagnosis on DSM-5, or who have screened as high risk through that screening process. This intervention educates them about their substance use, alerts them to possible consequences, and ideally motivates them to change their behavior. So in laying out the services for this webinar, we had to make the decision about just where we wanted to talk about medication-assisted treatment or in the upcoming language, medication-supported recovery. And we decided to put it right here at the front of outpatient services. Medication-assisted treatment is the use of medications in combination with counseling and behavioral therapies to provide a whole patient approach to the treatment of substance use disorders. I want to say a couple things about this. Medication-assisted treatment or medication-supported recovery, which is the language that OASIS would like to introduce, is a well-researched, science-supported intervention. And this intervention is not necessarily only used for opioid addiction, but it can be used for the addiction to other substances, and it includes more medications than simply methadone, which may be the medication that the majority of people are familiar with. This includes other medications to address both an array of medications to address opioid addiction, as well as other medications to address addictions to other substances. And again, I just want to stress that this is along with counseling and behavioral therapies, this is an evidence-based, science-supported treatment. And so I want to throw that in here because OASIS, the plan for OASIS services is that this treatment will be made available in any door that the individual you're referring walks through. So let's go to outpatient clinic. Outpatient services include a multidisciplinary team. There are different levels of intensity, and the type of treatment that an individual will receive in an outpatient clinic will include group and individual counseling, education, risk assessment, supportive counseling, and family treatment. Another form of outpatient treatment is outpatient rehabilitation. These programs provide an array of rehabilitative services, and they're targeting individuals with chronic medical and psychiatric conditions as well as substance use disorders. This service has a richer staff-to-client ratio, and they include rehabilitation services, not just treatment services. These services are often delivered multiple days a week for at least 4 hours a day. Also within OASIS's purview is problem gambling, and there are specific problem gambling outpatient programs. As is indicated in their name, these services assist individuals who are affected by problem and pathological gambling, including family members and/or significant others. They may be provided in freestanding settings or may be co-located in chemical dependency clinics, as well as other mental health settings. And again, they offer group and individual education, orientation to self-help groups, family treatment. In addition, these programs will offer financial counseling provided either directly or through outside referral. A more intense level of outpatient service is intensive outpatient service. These are for individuals who require a time-limited, multifaceted array of services, structure, and support to achieve and sustain recovery. Intensive outpatient can be delivered during the day. Some programs will offer evening and weekends, and it's a minimum of really 9 hours a week. Again, all of the treatment services are embedded within this service. Finally, there's the opioid treatment programs. These are specific clinic programs that deliver methadone or other approved medications to treat opioid dependence following one or more medical treatment protocols. In addition, they offer medical and support services, including counseling and educational and vocational rehabilitation. Patients are prescribed and delivered medication-assisted treatment, which is expected to be long-term medication management of the chronic disorder. OASIS is addressing their residential services through a redesign process. And so as we start to talk about residential services, I am going to talk briefly about the residential system as it exists today and the redesigned residential system in which, as we are recording this webinar, providers are transitioning to that new redesigned system. So I'm going to walk you through all of that. OASIS residential system has been redesigned. Providers, as I said, are in the process of transitioning to this newly designed service. If you're making referrals today, you will find that many residential programs are still providing service in the original model as they prepare their organizations for this change. The original model includes 3 levels of care: intensive residential rehabilitation, community residential, and supportive living. The new model provides 3 separate elements of care that can be accessed independently. Ancillary withdrawal and medication-assisted treatment must be available to all participants of these services. Individualized lengths of stay, person-centered trauma-informed treatment and planning is a must. Stabilization services. Now I'm going to talk about the new service. This is the newly designed system. Residential stabilization services seek to provide a safe and supportive environment for individuals who cannot effectively utilize outpatient services at the time of the referral, nor require inpatient rehabilitation. Within this service, individuals will receive medically directed care to treat acute problems and adjust to early recovery. You can see here on the slide the list of services provided within stabilization. The key difference, a key difference between the original system of residential and this newly designed residential system is that an individual can come into stabilization, get stabilized, and be referred out to an outpatient clinic. The original system of residential services, individuals walk through the 3 phases of treatment, the 3 phases within the residential system consecutively. It's not something that you can enter and exit at any point along the way. There's one entrance and one exit. Stabilization and each service I identify next can be entered and exited independently. So the next service within the residential system, newly designed system, is the Rehabilitative Services in a residential setting. Certified OASIS providers of residential programs which provide rehabilitative services address individuals who are stable enough to manage emotional states, urges and cravings, co-occurring psychiatric symptoms, and medical conditions within the safety of a residential setting. Services include medical monitoring of chronic conditions, including routine medication management and individual, group, and family counseling focused on rehabilitation. Finally, the last element is reintegration services. Reintegration services help individuals transition from structured treatment environments to more independent living. Services here are delivered outside, treatment services are delivered outside of the setting, so staff coordinate treatment services but do not provide direct clinical care. And finally, there's the residential rehabilitative services for youth. So this service is available for under 21. In July of 2007, all short-term and long-term RCDY programs began, which was an old residential model for youth, began converting to a new residential service that includes the following enhanced staffing pattern. Essentially, RRSYs really took on a more medically enhanced model to address a variety of treatment issues. I want to move now into recovery support and housing services. So recovery supports enable a person who lacks social, emotional, and community resources in the natural environment to maintain community-based living if the additional supports help stabilize them and provide enough support to enable them to manage early recovery in an ambulatory or community setting. Individuals and families can access recovery supports through the following services: peer services in a variety of settings, recovery community and outreach centers, case management associated with supportive housing, clubhouses for adolescents and young adults. Family Support Navigators is a service that's in development. Mutual aid groups, and Friends of Recovery, which is a statewide service. To focus more specifically on recovery community and outreach centers, these provide a community-based, non-clinical setting that is safe, welcoming, and alcohol drug-free for any member of the community. They promote long-term recovery through delivering a variety of supportive services. They also provide an opportunity for individuals and families to connect with peers so that they can benefit from shared experiences and commitment to common goals for recovery. Services are accessible during the day, evening, and weekends. Peer engagement services, again, this is in development. The primary goal of the peer engagement program is to utilize expertise associated with addiction and recovery experience and become a resource to individuals and families that present in various settings due to their substance use. It is the goal of the peer engagement to understand service delivery within a variety of settings and to effectively engage and partner with the target populations that are receiving service within that setting. Substance use disorder community-based clubhouses focus on prevention and provide a safe environment for adolescents and young adults in recovery or at risk for substance use disorders by promoting peer-driven supports and services in a non-clinical setting. Family support navigators, again, that's also in development, will assist families and individuals with gaining an increased understanding of the progression of addiction and how to navigate insurance and treatment systems. Moving on to housing. Permanent supportive housing includes all housing with an expected length of stay beyond 24 months. These programs include Shelter Plus Care, New York 3, and Upstate Permanent Supportive Housing programs. Permanent supportive housing can also lead to turnkey, whereby the lease may be turned over to a tenant who has reached a level of income that is sufficient to assume full rental responsibility. And now we're going to move into prevention services. Prevention services are targeting children and families. They are, this is not treatment. This is prevention providers are often found embedded in communities. They are well known to school systems. They may be well known to town and city youth advocate programs. These services are really community-based, using evidence-based practices to address kids that are at risk, families that may be at risk, and to really facilitate education and support using, with targeting prevention using evidence-based practices. That was a lot of information, and I would say that you may have questions. So please follow up with either the OASIS services. You can send your questions to the Pick'em mailbox at oasis.ny.gov. For OMH services, please send your questions to OMH Managed Care at omh.ny.gov. Before I wrap this up, I want to make one other point about OASIS services. OASIS services you can refer to directly. There is no middleman or in-between process required. So SPOA does not play a role in OASIS services. You can contact your local OASIS provider directly if you have an individual that you think could benefit from any of the services that I have identified here today. I want to thank all of you for taking advantage of this recorded webinar. I encourage you to look for the next in the series, which will focus on HCBS services. And again, I want to encourage you to use these slides as reference points in an ongoing way. Thank you again for your time.